What if our nerve gets cut? The injuries to peripheral nerves are quite common. They may occur due to compression, traction, trauma, intramuscular injection, etc. There are three types of nerve injuries. First, neurotmesis. It is interruption of axon and its myelin sheath. Second, axonotmesis. It is interruption of axon with preservation of myelin sheath. Third, neuropraxia. Both axon and myelin sheath are preserved. Recovery can occur in case of neuropraxia, neurotmesis, but some degree of function loss is inevitable with neurotmesis. When a nerve is cut, a series of degenerative and regenerative changes follows. Degeneration. When the nerve fiber is cut, the distal segment of the axon, which is served from the cell body, degenerates. This is called Walvarian degeneration. There is complete fragmentation of nerve fiber, including its myelin sheath. However, myelin producing sheath cells, Schwann cells, survive. In addition to degeneration of distal segments of the axon, degenerative changes are seen in the cell body. Cell body swells and nucleus becomes eccentric, that is, it drifts from its center. Cell bodies degenerate and form granules that are dispersed throughout the cell body. This process is called chromatolysis. The changes that occur in the cell body following an injury to its axon are called retrograde degeneration. Regeneration. The Schwann cells and macrophages distal to the site of injury play an important role in regeneration. The macrophages migrate to the site of lesion and phagocytose the debris. The neurolemocytes, Schwann cells, proliferate and forms a cord of cells called band fiber within the endoneurium. The part of axon that is connected to the cell body begins to grow, forming sprouts with bulbous tips and enters the cord of neurolemocytes. The neurolemocytes of the cord secrete a chemical substance, the nerve growth factor, that attracts the growing axon tip and guides it to its proper destination. Factors necessary for satisfactory regeneration are endoneurium and neurolemal sheath should be present intact. Distance between the cut ends should not be more than a few millimeters. Presence of nerve growth factor. Fourth, infection should be absent at the site of lesion. The peripheral nerves, if damaged, may regenerate, but the nerve fibers within the CNS, that is central nervous system, cannot regenerate after damage due to the absence of neurolemal sheath and endoneurium. Clinical correlation. Nerve repair. The served major nerves may be surgically reconnected and the function of nerve re-establishes if the surgery is performed within the first 72 hours of the injury. The axon grows at a rate of 1.2 mm per day. The regeneration may take 3 to 6 months. So this is how, if a nerve fiber gets cut, it degenerates and forms via series of changes and steps.